Good evening, friends. I am Dr. Lodha, specialist pediatrician and specialist neonatologist at Belhol Specialty Hospital, Dubai, here in Dubai. I hope you all are healthy, fit, safe, and fine. Friends, today on my talk show, I thought of taking a topic which is not so uncommon, but yet very intriguing. The moment that topic, that word comes to our mind, most of the non-medical persons, they have a strange kind of creepy feeling, and that word, that topic is autism. Uh, Fortunately or unfortunately, we have seen rising in the cases of autism. And people at large do have lots of myths, misconceptions, sometimes social stigma also, if someone in their family is suffering from autism. To throw more light on that, to clear all that haze and mist around autism in people's mind, I have invited on my talk show an authority, very knowledgeable person, and who has an illustrious career. He's passionate about autism and developmental disorders in children in particular. He's none other than our friend, our academician, Dr. Samir Dalwai. Now, just I will give a brief introduction about Dr. Samir Dalwai. Dr. Samir is a pediatrician who is who has who is expert in development pediatrician. He is founder and director of Horizons Child Development Center in Mumbai, in India, which is very famous center since 2003. He's also attached to prestigious Nanavati Hospital, Hinduja Hospital, and Jaslok Hospital in Mumbai. He has also been awarded Rajiv Gandhi Manav Seva Award for services in children in 2012. And more than that, he himself is director of New Horizon Child Development Center. Now, this center is unique in a way that it has an interdisciplinary team of developmental pediatrician, and of course, Dr. Samir is heading uh, that that pediatrician group. There are clinical and counseling psychologists, occupational and physical therapists, speech and language therapists, remedial educators, and nutritionists. So you can imagine all these faculties are available under one roof so that children who are suffering from these development disorders do not have to run from pillar to post. So, Dr. Samir, welcome to my show.
Hello. Thank you so much for having me on your show, Ashok.
Yeah, Dr. Samir, you are very busy and still you have taken out time for our viewers. Let's straight away start bang on to the subject. Now, this autism, many parents, many viewers would like to know that what is autism, how common it is, and is there any epidemic of autism? Because of late we have realized that there's a lot of buzz, lot of discussion about autism. Is it rising?
All right. So, Dr. Ashok, like I said, thank you so much for having me on this show. And I'm very happy to share whatever information, experience I can share with all our viewers here. I'll take your questions in the reverse order. Is there an epidemic? So we know typically obviously it's not an infectious disorder, but yes, the numbers are on the rise, and that is also because of an increase in the awareness of the pediatricians in schools, in teachers, and even in parents, in the ability to try and recognize that a child may have a problem of this sort. At the same time, I do think there is actually an increase in the absolute number of children having this problem as well, and we'll discuss the reasons for that later. You asked me about what do we think or what do we know about autism. So I'd like to start off with a disclaimer right at the beginning that most of what I'm going to talk about is going to be my experience and what I have seen as what we call as autism. Because if we read the books as we did when we were in our residency, when
Yeah,
we read the definitions, it sounds like we have some neurological disorder. It's so difficult to understand. And that's why you said it's such a tragic word that we, kind of don't know what it means. Unfortunately, I don't think we have done enough to clear this misconception around it.
correct.
So we know that autism is defined and it's a genetic condition. It's because of a genetic predisposition. And it's at the same time, it's epigenetic. It's a neurodevelopmental disorder in which there are impairments
Mhm.
in two the parts of the child. One is the social communication domain and the other is repetitive restrictive behaviors. Now, when you say this, nothing much can be understood. So I'll try and simplify in terms of what I think I look at it as.
Yeah.
the concept that we have to understand is what is normal social communication development before we look at something which is abnormal. As we understand, every child, once he is born, on day one of your life, you really don't know anything when you open your eyes or when you hear. It's all noise to you, and it's all just pictures in front of you.
Yeah.
You start relating things, but the only thing that stands by you or is your instinct at that time is a survival instinct. So the baby cries when the baby is hungry. When the baby cries, nothing in front of the baby moves except one entity. Well, we know that entity is perhaps the mother who picks up the child and feeds.
Mhm.
Over a period of time, when the child cries again and again, and he realizes that it's only one entity in the world around me that comes to my aid or helps me and feeds me and makes me feel better. Over a period of days, the child realizes that the world around it has two parts. One part that interacts with it and helps it and benefits it, and the other part that couldn't care less, which is
Mhm.
non interactive and inert.
Yeah.
And therein lies the concept of the human child understanding the fact that I can interact or engage with some entities in the world, which obviously we know now or
Mhm.
later are living beings or humans. And there are some entities with which we cannot really interact. They are inert. So we know that that is the object world or they are the objects.
Yeah.
Obviously, over a period of time, the child pays more and more attention and engages more and more with the interactive bit, that is the humans, because that's where all the support and the care is coming from. And while doing that, the child starts observing the way humans behave and interact with each other. This form of behavior, like people comb their hair, they wear clothes, they
Mhm.
eat food from a plate, they have a bath in a shower. He observes all this. Over a period of time, he also gets smarter and he learns that, well, different people wear different kinds of clothes. So
Yeah.
they're not all the same. Different people comb. The father may not have much hair to comb, but the mother may do an elaborate job of it.
Mhm.
So he gets smarter in understanding human behaviors. Then he realizes the further nuances that the mother behaves differently when maybe her own sister is there, but her behavior kind of changes when maybe the mother-in-law or somebody, some other stranger comes into the room. He also notices that the mother's behavior or the father's behavior is different when there are no guests in the house. But if there is some stranger, suddenly the behavior will change. So all this the child is observing, that people eat food in a plate, people dress, people comb their hair. All these are normal human social behaviors. Animals don't have this. So the child has to learn this by observation, and this is happens in the very few first months of life. By the time the child is 8 9 months of age, he also realizes that people connect to each other
Mhm.
by
Yeah.
facial expressions. By
Yeah.
So he starts picking up non-verbal communication, where people give signals and messages to each other. And over a period of time, again, by the time the child is 1 year, 2 months, 3 months, he realizes that just like this is a physical symbol, this is not just a waving of the hand. This is a physical symbol indicating I'm going away. He also realizes there is a sound in the air which is bye bye. When I do this, bye bye or tata.
Yeah.
So the child realizes just like there is a physical symbol to communicate something, which is non-verbal communication, there can also be verbal communication, which is nothing but speech.
Mhm.
So all of this are gained by the child in the normal development by exposure and interaction with the environment. So I have put it down in a sequence, and
Mhm.
I call it the social communication sequence, where
Okay.
the first step is social interaction, engagement.
Mhm.
The second milestone is learning social behaviors. The third is learning non-verbal communication, and then finally the fourth is verbal. But in a child who has a genetic predisposition towards developing autism, we have seen that the first step itself is impaired.
Oh.
So the child does not pick up that difference between living and non-living, does not have that ability to interact to and fro, engage to and fro with people as much as a child who's typically developing. Now, what we must understand is this is a flaw in the first step of the sequence or in the first milestone. So, if this doesn't get picked up, the remaining milestones are not going to get picked up. So, obviously, this child who is not engaging or interacting will not learn consequentially normal human behaviors. That's why he will not learn normal non-verbal communication. And that's why he will fail to learn and pick up speech. So not picking up speech is a consequence.
Oh.
But the first clinical problem that happens is lack of interaction.
Mhm.
And why I'm saying this is very important, because very often what is picked up, 95% of the parents who come to my clinic come for the complaint of child not speaking,
Yeah.
because that's what we notice.
Yeah.
But the mistake is to start with speech. to try to get the child to speak. It's like a child who's not even sitting, but is 2 years old, who should have been walking by now. You try to directly get him to walk. That's not common sense. Tells us it's not possible. So this is why we must understand where the first clinical step goes wrong. You take the first wrong turn and then you're on the wrong road all through. Unless you go back to that first wrong turn you took, you're not going to get back on track. And
Yeah.
the other thing that happens when you have this genetic predisposition is, if you are not going to engage with humans, whom are you going to engage with? So if you see, the objects around us are multifold number of times than the people. So this child starts engaging or paying that much attention to objects. Now all objects around us are arranged in patterns, and those patterns are rigid and fixed. These are the two things that define an object. It's a pattern, and the pattern is fixed. So the child who picks up normal, typically the nuances of social behavior and social communication, in this case, he is an expert at picking up the nuances of patterns. So he would be very good at any kind of pattern. So if he hears A, B, C, D, it's a sound pattern to him. He will be able to repeat A, B, C, D. If he hears the words mama, mama, mama again and again and again, or dada, 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 it's a pattern to him. He doesn't understand that he's expressing it by calling out to the mother as mama. For him, it's just a pattern. So he'll say to the mother, to the father, to the aunt, to the wall, to the door, everything. Similarly, if he hears a nursery rhyme or a school rhyme, it's a pattern to him. He may hear a prayer, that's a pattern to him. He may learn the rhymes and he may repeat that. Now, what confuses us is, look, this child is speaking, but that's not speech. That's echolalia, but that's basically repetition. Because this child is brilliant at patterns. You write A to Z. I had a child who came to me once. He would write A to Z. So I said, write L. Again, you would start with A, B, C, D. Okay, write P, A, B. So for him, it's a pattern, it's a design. And that's why you have children with autism who would be great musicians, or even mild autism, but they could be great economists. Because just as they have a problem with social communication development, they have a great predilection for patterns. But the problem here is, patterns are rigid. For example, I gave you, when the normal typical developing child sees his parents behave differently with him when they are alone, and says the behavior change when a relative or a guest comes in. Here, the pattern, but when the parents change, their shirt pattern or the buttons of their shirt doesn't change. Here, the child is like that. His behavior will be the same always, because objects don't change, the patterns don't change. He becomes rigid. Whereas the guy who's typically developing social human social communication is adept at change and dynamism. I mean, the best example of it would be a politician or a diplomat. He would enter a room and he would know what to say. He would go to the next room and say exactly the opposite thing in like 2 seconds. So his social communication is developed to that extent. This is the opposite in a child with autism. He would be very, very poor at this. He would do the same thing over and over everywhere else. But he would be brilliant at picking up patterns. Unfortunately, and this is a very big statement that I'm making, I could be wrong, but I believe this very thing. Unfortunately, the repetitive part or the patterned expertise of a child, which is I consider a problem, is actually in a way exploited by many of us. Because then we teach the child nursery and say, hey, look, I taught your child to speak. We teach the child to copy ABCD. Hey, look, I taught your child to write. This unfortunately takes, the first 2 years are gone because we don't realize anything. The next 2 years are gone because we are only teaching the child to mimic speech and mimic designs while reading and writing. By the time the child is 6 years old, he's going to a school with a bunch of unknown children. He doesn't know what to do where, much less what to speak where. What sets in is anxiety. And that reinforces his repetitive behavior. And that's what you have as an autism spectrum disorder.
Oh, so viewers, you must have realized in 10, 15 minutes how passionate, how much knowledgeable Dr. Samir is. You just have lots of words of wisdom, so much information. Sometimes you need time to grasp and understand.
Sorry, if I was a little quick, but we can do this again.
Fair enough. We could understand that the important thing, most of us, even healthcare professionals or general pediatricians, also focus a lot on speech. But Dr. Samir is emphasizing speech is later on, the sequence. The initial thing is to catch them much early, the social part. So can you explain slightly again that part for the parents that won't wait for speech to be detected? That how early and what red flags they should take into mind?
Good, very good question. So I've explained the concept. Now I'll explain the red flags as Dr. Ashok sir said. A child with autism would not have a very early social smile or a good eye contact. But we must remember what we mean by eye contact. No,
Yeah, yeah.
I'm staring into your eyes, but this is not good eye contact because it's meaningless. So if I look at my mother
Ah, okay. Think.
smiling response of a child
Mhm.
in response to a pleasant, familiar stimulus. Every word is important. The response, it's a
Yeah,
response.
Dr. Samir, I think for a few seconds there was some internet problem. Can you repeat last two, three sentences,
Okay.
starting from
Yeah.
the eye to eye contact? This concept is
Yeah.
very important.
Right. So when I just do this, I'm staring in your eyes, but this is not good eye contact because it is meaningless. But when I look at my mother or a person whom I have an attachment with, and I'm happy and I express that by smile, that's a good eye contact and social smile.
Ah, okay.
So social smile is defined as a smile in response to a pleasant, familiar stimulus. Every word is important. The fact that it's a response is very important. So if I'm looking at the wall and smiling, it's
Yeah,
not social smile.
correct.
If I have a kind of a villainous guy, like some very scary person coming in front of me, and I'm smiling, that's not normal.
Correct. Yeah.
But it has to be a response to a pleasant and a familiar stimulus. So it is more here than here or here.
True.
It is more here.
Yeah.
That is what we have to understand. So the child will have delayed or impaired meaningful eye contact, will have impaired social smile. Going on ahead, we know that the child, when the mother calls out, the child starts at least looking in her direction, starts responding when he hears the mother's sound. This child will not respond so much. Then the child starts recognizing his own name because he knows when he hears that sound, say Ashish. Okay, every time they say Ashish and they look at me, perhaps that's what I'm supposed to look back and smile for. So the child starts associating this. A child with autism, because he's not engaged, he will not do that. Going ahead, the child responds with good non-verbal communication. If you wave, the child will look at you, understand, and wave. And very important, cuddle, hug. You put out your hands like Shah Rukh Khan's favorite style. So the child also put out his hands to hug you back.
Yeah.
This to and fro reciprocity, we hear this word in the textbooks very often, but difficult to understand. So I'm explaining it in a simpler way. This reciprocity, Ashok bhai, you're smiling at me, I'm going to smile back at you.
Yeah.
So, this is what is missing. And the child does not have these big hugs or big smiles when the mother may come back from work or whatever. There is no great change in this baby's demeanor because there is no interaction at all. Whereas a child who's typically developing will hug the mother, run to meet the mother, may cry when the mother is going away. All these are red flags which are not there in a child with autism. There'll be delayed understanding of non-verbal communication, and there will be, of course, a delay in speech. The important point parents must note here is the child, there's this whole concept around 33%, one third of autism being regressive autism, that the child was developing normally and then he regressed. I haven't seen 33% children regress for sure. Maybe 2 or 3% in my practice. Okay. So what is this great big 30% that we say, no, my child was developing normally and then he regressed? Very often what we fail to take is a very good history, and that's what the pediatricians need to do. The history is, the question we ask is, was your child speaking? Well, the mother, not her fault at all, would say, yes, he was speaking. What was he saying? So he was saying mama at 1 year. He was saying dada. You have to ask very clearly as a clinician, would the child look at you, would have an intention to connect with you for some reason, for some purpose, and meaningfully say the sound mama to you? Yeah. Does he have any benefit to gain from it? Does he have a purpose? If not, if he's blankly saying mama, and he, like I said, to you, to the father, to the wall, to the refrigerator, to the toy, then it's not a meaningful word. So for a sound to become a word, there are 3 categories that I put to it, or 3 definitions. The sound has to be used interactively, it has to use meaningfully, and it has to be used purposefully for it to become a word. For example, maybe in some part of the world, we say mama to the mother. In Maharashtra, for example, we say I. Now, you may not understand what I means.
Yeah.
For you, it's sound.
Mm.
You may not use the word I to your mother. In maybe Maharashtra, they may not use the word mama. They use the word mama for maternal uncle.
Correct.
So
Yeah.
the meaning of that sound is what I meant, whether you say I to the mother or you say mama to the mother. And the third part is purpose. Am I calling out to my mother with a purpose of drawing her attention or getting something to eat? Now, if this is absent, what's happening is just meaningless repetition in the patterned way that I told you. And that often fools us that the child was doing well otherwise.
Yeah.
There are many children, most of them, who develop normal physical milestones like sitting, standing, walking. But lack of social and communication milestones are important. And then this child is more engrossed in himself. Actually, he's engrossed in objects. But we think he's engrossed in himself. He's all the time engrossed in patterns and objects. And parents will tell you, he knows exactly, doctor, while coming to your clinic, to take a right turn or a left turn. He knows exactly how to use a mobile. He can know how to press the buttons on a remote. Anything which is a pattern and is to do with an object, the child will be extra brilliant at, whereas will be lacking behind. So both these things parents need to notice. Finally, if there is a doubt, nothing like consulting an expert and your pediatrician. That's very important.
Yeah. So viewers, even lots of words of wisdom. Dr. Samir clearly told that it's not mere staring and having eye to eye contact or babbling some words. There has to be a purpose and a meaning to that word, to word, verbal or non-verbal communication. That's the catch thing, which even I would admit that most of the pediatricians forget that concept. We have read it, but we don't practice. So as a parent, please understand there has to be a purpose and a meaning to both verbal and non-verbal communication. If that is missing, then perhaps you should take an opinion from an expert. Dr. Samir also brought out one interesting concept of the well-developed some kind of pattern in these children. So do these autistic children have some level of intellectual disability or some domain of the brain are extraordinarily developed, which we can work on that further in their life?
All right. So that's a good question. When we talk about intellectual disability, what we talk about basically is not just the IQ, but it's the adaptability, whether the child can adapt to the situation and the surroundings. So because these children have a problem with social communication, they obviously would have a problem with adapting.
Yeah.
But intellectually per se, they might be very good at doing things which are patterned, like I explained to you. So they will be very good at something that they have observed on their own and they are seeing. Now, if it is something that is beneficial in the human life, obviously you will be appreciating it. Like, for example, many parents appreciate that my child is able to use a mobile phone or a gadget.
Yeah.
So, well, it does show intelligence because he's able to understand how to figure out those numbers and the buttons. But the trouble is, if the child gets engrossed too much in the patterns, that is going to keep him further away from social interaction. So when I say that this was a genetic thing, what probably we meant was that basically the child lacks the potential of social interaction as much as another typically developing child, which means that those of us who lacked it partially, but got a lot of it from our environment from day one of life, we were able to catch up. It's like a malnourished child or a low birth weight child. You get good nourishment, you will pick up. I'm comparing it to the same model. And I mean, these are all my observations. So you can take it as this is my thing. So I mean, there's no book which publishes this so far. We need to study this. But this is what I've observed in 18 years. So basically, when you ask why is this epidemic increasing? Well, let's look at the way society has changed. A couple of decades or even 3 decades back, one generation back, the genes were always there. This is not a new gene. Some mutate, of course, are mutated, but these are thousands of year old genes. But a generation or two back, there were so many people around the baby. There was so much of social interaction that even if the child, because of his genes, partially lacked social communication, nobody would leave that little baby alone. Everybody would keep talking to the baby, aunts at home, uncles at home, cousins, brothers, everybody. So that prevented or that helped the child to gain a little bit of social interaction right from day one of life. And then gradually as he gained that, maybe he was a little late at social behavior, maybe a little late at speech, but he did catch up. And then maybe throughout his life, He was a little poor at social interaction. So maybe he was a little absent-minded genius cousin of ours. Maybe he was an absent-minded professor who
Yeah.
would not speak much. Or
Mm.
maybe he was that cousin who went on to become a big scientist, or he was a great engineer or a doctor. He wasn't really the jolliest person in the family, but he did very well.
Okay.
Today, the child lacks the exposure because it's become like the families have become nuclear.
Mm.
And on the other hand, the child is given a device at birth.
Yeah.
I have seen children as young as 3 months old.
Ah,
I'm not kidding you. 3 month old babies being given tablets to watch
yeah.
nursery rhymes on so that they eat. So as it is, this child had a little less potential for social interaction. Now even that's gone. There
Yeah.
are not many people around, and he's on the tablet. So he's not even going to look at that time when the mother or father may be around. And for this, again, I think it's very important to understand not to blame the mother. Because I've seen in our part of the world, it's all comes down to the mother. The
Yeah.
mother has to be the wife also, she has to be the daughter-in-law also, she has to cook food also, she has to work also, she has to look after the house and see that the child doesn't use the mobile. That's not going to happen. It's equally the responsible of the responsible father, the parents, the in-laws, and it's the neighbors, the society. All of us need to help children develop. We cannot outsource it to the mother only, that she has to do all of it, because the child needs so much of, because see, even if he pays attention to the mother, he's only going to pick up one style of social communication.
Yes. So true.
He needs to develop, learn from everybody else.
Yeah.
So this is extremely important, that we engage the child right from the time the children are born, and we make sure that the child gets to interact with as many people as possible.
Yeah, so well said. Yeah, earlier the joint family concept was there, so many social interaction stimulus were given to the child,
Correct.
and you rightly brought up this subject of screen time, the tablets and mobiles and all. Nowadays there is e-learning, digital learning at home. Most of us, even children, and we all are now also we are looking at the screen, so we just
Yes.
can't avoid this part. So, any message for the parents of the autistic child, whether this excess screen time will trigger or help or deteriorate their symptoms or signs?
Okay. So it's very important to understand what causes the problem. Again, I'll say this very humbly. The basic step that goes wrong is only one step, and that's the step of social interaction.
Mhm.
Because social interaction, the child doesn't learn 100%. The next step in the sequence, learning social behaviors, the child doesn't learn 100%. Maybe he'll learn only 40, 70%.
Mhm.
The next step is non-verbal communication. So because the earlier step is not very good, non-verbal may be only 40%.
Yeah.
And because of that, the verbal can be only 20%. So sure enough, children will improve. But make sure that you start at the bottom floor or the ground floor.
Mhm.
Make sure that the child gets plenty of social interaction, becomes good at social interaction. Then make sure you use, or make sure that you get your child involved in day-to-day activities at home. I spend a lot of time with my patients just explaining them, get your child to work with you in the house.
Yeah.
Get your child involved to do household chores, not because you need
True.
somebody to help you, but because that is where the social interaction and communication the child picks up. Very often what happens is we directly pack him away to an institute or to a doctor or
Yeah.
to a whatever.
Yeah.
That it will help the child learn, but it will be only in the, like everybody does well when they come to my clinic, but he may not do anything in his house. There's no use.
Yeah.
There's no point my therapist or my therapy team getting the child to do everything in my clinic, and he can't do anything at home. It's very important that he learns to do at home. So make the child do everything that happens in the house regularly. That will get him to learn social behavior. Automatically, I'm using the word automatically, he will pick up non-verbal communication and verbal communication as well. You do not need to specifically, there's no paralysis here that
Yeah.
you need to give some exercises. It's here. He needs to understand why to communicate and how to connect. He will find out the words on his own gradually. Of course, you need a lot of therapy, you need a lot of help for this. But remember the sequence. After the speech, then comes reading and writing. Because when I know, hey, this is an apple, I know the sound apple. In my mind, there's an image of the apple. Then somebody tells me, hey, listen, when you need to write to somebody who's not in front of you, I mean, you
Mhm.
write on a piece of paper, right? That's how it was invented. So
Yeah.
we break down the sound apple into a concept
Mm.
of alphabets and phonemes. And then we say A, P, P, L, E. This is a concept, it's an abstract concept. How can you build up on an abstract concept unless the concrete is there? If the child doesn't understand what apple is, how can you say teach the child A for apple, B for bat? What are you talking about?
Yeah.
Alphabets come later after you already have good verbal communication. But unfortunately, very often it is taught that if the child learns A for apple, B for bat, it's a pattern. He
Attend.
doesn't understand how to use it.
Yeah.
So I would say go slow. Your child will learn everything, but don't jump the sequence because you can't bypass any step of the sequence. And when it comes to learning online, so parents tell me, no, from cartoons he's picking up words. My suggestion is he's picking up words from cartoons, but he's also picking up cartoon behavior from cartoons. You
Yeah.
don't want him to behave like a cartoon. You watch the cartoon, shut it, and you behave like a cartoon. You jump up and down, you dance, you do whatever the cartoon is doing. So let the child's attention get focused away from the object up to you.
Yeah.
You cannot be the serious CEO or the great doctor in your house. You have to be like a 3-year-old kid. I call this joker therapy. If you are like a joker, the child will look at you. If
Yeah.
you are boring, he'll prefer to look at the door.
Yeah.
So you need to be very interactive. You need to be very engaging. I tell people to look at this movie called Patch Adams. See, he goes around wearing this red bulb on his nose like a clown. Everybody likes to see it. He brings a laughter to everybody. Children look at him. So be very interactive with your child. It's not the screen that is going to get. Screen is eventually an object, and
Yeah.
the child will get fixated on using the screens.
Yeah.
I would say please stop it, and you interact with the child and get the child absorbed in your world and build up the child's social interaction. Once the door is open, he walks through and he observes everything and he picks up everything. But the door is closed. That's social interaction. That's the first step. You need to get that open.
Yeah, so well said. But due to this unprecedented corona time, all the more children are, many of them are not going to school. So they are willingly or unwillingly deprived of the social interaction. And not on top of that, parents, if they give some screen on their hands, children are bound to suffer from social interaction. So as Dr. Samir is clearly saying, don't let the child in you die, even if you are CEO or doctor.
Yeah.
With kid, you become kid. You do all very well said. You become cartoon. Don't bother that it's beyond my dignity, beyond my profession.
Yes, exactly.
Yeah, you have to kill your inner that inhibitory impulse or fact,
Yes.
and that will work magic for the children. Dr.
Well
Samir,
said.
another point is, do these children who are having autism, the regular schools, will they take them up? They can be enrolled, or there are some special schools. Can you throw some light on that?
Okay, so it all depends on what is a school taking in the child. It requires a particular level. Like, for example, junior KG somewhere would require the child to be able to speak so that it can teach the child further. So there's always an intake criteria for the syllabus, and then you build up on that. So
Hmm.
there's a sequence there too.
Oh,
So if your child is not conversing or doesn't have verbal development, then he's going to find it difficult to pick up reading and writing. That's what I explained earlier.
okay.
So it's the question is not whether you should put your child in a regular school or in a special school. The
Hmm.
question should be at what level of development is my child and what is the level of development that is expected for this syllabus or for this class.
Okay.
If they match that, see, it's a child is no problem.
Hmm.
Suppose a child has never gone to school.
Hmm.
He has stayed in some back of beyond. Directly is now 8 years old. Can you directly put him in class 4 somewhere?
Yeah.
It's not possible because he's not to that level. So you need to look at your child's developmental level, not the age, because obviously he's lagging behind his development. So don't just go by the age. And okay, my child is 4 years old, he can't go to the junior KG, I have to put him in special school. No, that's not the concept. The concept is in the first few years of life, you need to work with a developmental team of pediatricians and
Yeah.
therapists and a team to understand these concepts and whatever the child is lacking with your help as parents, because you can
Yeah.
do the most. In fact, now because of this COVID situation, our centers are all shut down. But we've worked with parents, coaching them on an
Yeah.
online interactive program, and it's working wonders. There were children who were coming to the center and not doing so well because I think perhaps parents thought that okay, we are doing therapy 3 days a week. That's great. No,
Yeah.
now when they are coaching the parents, they are doing this 24 hours, and the child is doing so much better. So in fact, I've become converted more to this online interactive kind of coaching of
Yeah.
parents because it's working very well. And just to come back, Dr. Ashok, to what you said about this COVID times. So in fact, now like on Zoom, we are interacting.
Mm.
So as long as I can see, the child can see a normal human being or animals,
Mm.
it's okay. The problem is with animation and with games
Yeah.
and hearing the same repetitive nursery rhymes again and again.
Mm.
So I tell parents that I understand you can't go out and meet uncles and aunts. Have a call like we are having now, but
Yeah.
don't put it on the mobile phone. The trouble is once the child gets a gadget and buttons in his hands, he is not going to give it to you. I tell parents try and switch your WhatsApp, the whatever communication you have, to the television or at least
Yeah.
to the laptop,
Yeah.
so the child can't press buttons.
Sure.
Then you can have, there are people whose parents are in another country.
Yeah.
I'm very happy to say that please put them on the TV all day. I mean, grandparents often are free. Let them be on the TV. Let the child keep interacting with them on the TV. But you can see, like I can see you, you can
Yeah.
see me clearly.
Yeah.
So it's not the screen only. It's
Yeah.
what is being shown through the screen that's important.
Hey, Dr. Samir is an encyclopedia. You really have so many pearls of wisdom. Such a simple and small thing. He told viewers that he's not against interacting on WhatsApp or Zoom, but he's telling clearly not on the mobile, because otherwise the control is in his hands,
Absolutely.
child's hands. The control should be in your hands.
Your hands.
Your hand,
Absolutely.
yeah. That's such a simple, important thing. And other thing is, Dr. Samir's this they have, because of this COVID time. No, he told rightly that because of some children might want some sessions and they can't come physically to their center. So in their center they have this online intervention and counseling service for children and parents. So this is add-on benefit they have started in their center. And of course, there's no geographical boundaries. Anyone in the world can access this service. Yeah. So a few more questions which parents often think that is there any test? Because you have told us pointers, red flags, soft, subtle signs. Still, some of the parents may not be that much perceptive or understanding to pick up those signs. Or for that matter, even general pediatricians also would like to know, is there any test to diagnose or it is purely a clinical catch?
Well, I would say it's clinical, but there is a very good tool which is a screening test which was developed by Dr. Simon Baron Cohen in Cambridge, and it's available for free. I would recommend all my pediatrician
Yeah.
friends on your mobile. You just
Check.
look for MChat online,
Yeah.
and you can use it hundreds of times. Every patient you can use it. It takes about 5 minutes, and you on your phone you just ask the parent questions and you can write and you get a score at the end,
Yeah.
and you get a risk evaluation depending on the age of the child. You
Oh.
can use this test as early as 16 to 17 months, even maybe 15, 18 months for sure, and you
Yeah.
can use it up to 30 months as a
Mhm.
rough guideline. So
Right.
at least it helps you explain to the parent what's happening. But I would have a very request to the pediatricians or to the clinicians. What happens is, unfortunately, this word autism has got a very, very bad stigma and a bad connotation
Yeah.
to it.
Yeah.
And that's largely been because we've not really understood what it is. In
Correct.
fact, like I said, the word, I'll just take one more minute, Dr.
Yeah.
Ashok.
Sure.
The
Sure.
word
Please go.
autism
Yeah.
was coined by Dr. Leo Kanner in 1943 in John Hopkins. In Hindi or Marathi, when we translate this word, the word has been translated as Swamagna. In Sanskrit, basically.
स्व
Swamagna.
मग्न
Magna.
मग्न आप इन्वॉल्व अपने में इन्वॉल्व होना.
So it's a wrong translation.
Okay.
The word autism doesn't mean swamagna. It doesn't mean self-involved. So I always ask the parents, I mean, Gautam Buddha was self-involved or the Rishi Munis, because then your journey
Yeah.
within yourself. That's not
Yeah.
what this child is doing.
Yeah.
What Kanner used the word autism for was coming from within.
Mm.
Autos is self.
So,
He didn't say self-involved. He said it is coming from within and used that word because his challenge was to differentiate it from childhood schizophrenia.
oh,
So
okay.
he said schizophrenia is developed or acquired rather.
Hmm.
But there has been a normal development and then you acquire schizophrenia as an adult.
Mhm.
So even in childhood schizophrenia, it is a few years of normal development and then the child develops those features. He said autism is from the beginning of life.
Oh,
It is coming from within the child and it is from beginning of life. That is why he used the word autos, he used.
hmm.
But actually, if you want to use it, it's not swamagna. I use the word vastu magna or object involved.
Yeah, yeah. Yeah.
and human less involved. Now,
Hmm.
this sounds very maybe down market, doesn't sound like it's come from Harvard, but
Yeah.
it tells the parent what is going wrong
Yeah.
and it empowers the parent. When
True.
I use a high sounding word like autism
Correct.
spectrum disorder, I can charge high fees because it's like a fancy title that I'm giving. When I use a but the parent can't do anything, he gets scared because he doesn't know what to do about it. When I tell him that, look, your child has a deficiency
Hmm.
in terms of social interaction, लोगों के साथ, I mean, interacting with people, he has a little deficiency
Hmm.
and he has an overdose of interacting or being involved with objects.
Objects.
What will you do? So the parents say, doctor, that's so easy. We
Hmm.
will increase his interaction with humans and
Yeah.
we will decrease his exposure to
Yeah.
objects.
So well said.
Done. That's a good starting point.
Hmm.
I'm not saying that's the end of it, but
Yeah.
it takes away the fear from parents.
Yeah.
And that is our first duty as doctors to do, not to scare the parents. And you're not lying, you're telling them the truth
Correct.
because they can see it. The moment you tell them this, most of the mothers will say, that's right, that's exactly what my kid is doing.
Yeah. I think that
So if
that
we put it in this way, it helps the parents.
yeah, that's precisely the purpose of calling you and inviting you on my talk show to spread the awareness that don't be scared of the word autism. As Dr. Samir has said, it is a genetic predisposition. And don't feel guilty, especially the mothers, that she didn't do
Absolutely.
well and there was some fault in the grooming. So this is the usual story. Most of them blame it on Rio, blame it on mother. It's so simple and easy. And that another question is coming to my mind that about the genetic predisposition. If there's one autistic child in the family and mother wants to have second baby, she wants to get pregnant, is there any risk of recurrence in the
Yes.
next siblings?
Yes. So we all know that now the incidence, the prevalence of autism is about almost 1.5 to 2% of the normal population. So that's the risk everybody has. But if you already have a child with a known diagnosed autism
Mhm.
spectrum disorder, it's 10 times more in the next baby.
Okay.
Definitely. So it tells us that it has a genetic predisposition. When we say this, we don't know exactly which gene causes that.
Yeah.
There are many genes which are associated with it. So nowadays we have a gene panel and all that.
Hmm.
But the single most recognized cause is Fragile X. So if you have another child in the family, or if you have a history of repeated miscarriages
Miscarriage.
or a
Okay.
bad obstetric history
Hmm.
amongst the family members, then it's very important to understand that we need to do a test for Fragile X, which is not very expensive at all.
Hmm.
Many children, not many, but some children with Down syndrome exhibit autism. So
Hmm.
the most recognized cause is Fragile X. So you may, if there is a dysmorphology or there is a strong family history, you
Hmm.
would recommend a Fragile X test for the family.
Okay.
Also, like we mentioned about MChat, that is a screening tool.
Yeah.
But and if that comes positive, then you don't need to have a diagnosis to start working and intervening with a child with autism. Certainly, you don't need anything in your own house. And when you ask me about the second child, I
Yeah.
would tell the mother that yes, but I would still tell them that it's a risk. There are some genes we can test when the lady is pregnant.
Yeah.
And if we find the same gene sequence in the previous child,
Hmm.
one of the parents, and the unborn child,
Yeah.
then we know that this child is definitely at risk.
Yeah.
But if you are not able to do all these tests,
Hmm.
I would suggest that you go ahead and take the chance.
Yeah.
But you know right from the beginning what to
Yeah.
work on. From day
Precisely.
one of your child,
Yeah.
keep the mobiles away, keep a large part of the objects and toys away, and interact with your baby. Keep
Yeah.
speaking, keep having fun, keep kissing the baby, hug the baby, cuddle the baby, tickle the baby. Do it everything old-fashioned how the grandparents used to do. You need to, like you mentioned, don't have that inhibition.
Yeah.
Just behave like a child. That would help. And of course, then there are many tests that we as developmental pediatricians would do, and there are assessments. But I don't, that's not for to worry the parents about that. That any good. So I would only say be sure you go to a certified practitioner who is with a team, because no one doctor,
Yeah.
not me, not anybody else, can give you all the solution. You need to have people who work in
Full
a team
team. Yeah.
with each other. Always ask for credentials. Look at the certification that you see,
Yeah.
and very important, ask for documentation, ask for reports. Because when I sign below a paper, I
Hmm.
think twice about what I'm diagnosing or
Yeah.
advising before I sign. So make sure you get reports from the experts.
Yeah. Very well said. Yeah. Uh, Still, there are many parts of the world, perhaps in India and some families also, they still consider it as a social stigma once they come to know that their child is autistic. Despite awareness, despite so much of information availability, deep down in their heart, the initial feeling is of denial or rejection. And more than themselves, they are worried about people around them, the school, what will we get?
Exactly.
Yeah. So, is there any message, some tips you can give to overcome this social stigma part?
Yes. As I said again, and as you rightly said, it has to do with the other people rather than the parents
Yeah.
themselves. It's the society that needs to understand this. And hence, I don't see, none of us have the same social behavior or capabilities. Like I mentioned, a politician would go to a room full of people and know what to say, and would go to another room and know to say exactly the other thing. So he is highly endowed on social communication.
Mm.
Whereas some of us would be not so highly endowed in terms of communication,
Yeah.
or social. We would be okay. This is the way I am, and I prefer to be this way. So
Correct.
it's a spectrum of which I call human spectrum. It's
Mm.
not an autism spectrum.
Yeah.
Autism spectrum is a small part of it, which is labeled. So
Mm.
our philosophy is from label to enable.
Mm.
Don't
Yeah.
bother too much about the labeling.
Yeah.
Enable the child. And
Yeah.
to enable child, you need to understand where things started going wrong.
True.
Just correct them and things will improve. And society should know that all of us are in a spectrum. All Some of us have a big nose, some of us have a
Yeah.
small nose, some of us have a funny voice.
Yeah.
It's part of nature to have diversity. It's
Yeah.
part of nature. There are children, there are people with autism who have the biggest inventions in the world, who
True.
have been the biggest musicians, who have been the biggest mathematicians,
Yeah.
who have been the biggest scientists. So they have, if they would not have been there with their phenomenal attention to patterns and repetitive patterns, we would not have had this great expertise in physics and perhaps engineering and economics. So we need to understand that diversity drives the world ahead, and we need all kinds of diverse people around. So
Yeah.
it's important for your child. Let me say this very clearly. If your child is so-called typically developing,
Mm.
it is important for him to see a child who's not typically developing.
Mm.
That is going to teach your child how to adapt to that child.
Yeah.
Your child is benefiting.
So,
So don't do this of telling the school that, look, we don't want that child coming to our school
yeah.
because he is a bad influence on our kids. Not at all.
Mm.
Your child is getting an additional benefit of learning how to develop himself,
Yeah.
adapt himself to deal with that other child.
Yeah.
So be accepting of diversity.
Mm.
The history of the world is replete with stories of disasters and wars when we try to be too narrow focused on these are my people or my kind of people. That's the
True.
worst thing mankind can do. Accept everybody
Yeah. Dr. Samir is really
for
going
your own
on
good.
philosophical zone and orbit, which makes
Sorry, yeah.
logical sense. No, it's fine. It's fine. People do correlate. People do connect with what you're talking about, and such an important thing. The child who is specially able, he's doing a favor to other child who is perhaps developing normally, and he's helping him to improve his adaptability quotient or ratio or whatever you call it.
Absolutely.
Yeah. And generally speaking, in life, we always say that we should know ours and others' strength and weaknesses and work on that. And so is the
Exactly.
case with this autistic child. Parents or the people around them or the teachers or further down in their career, they should work on their strength rather than weakness. Weakness is
Yes.
social interaction, but they may have some intellectual strength. I think some people have them great mathematical ability. If you remember that Rain Man, Dustin
Yeah.
Hoffman picture, so doesn't fit exactly into yeah, that brings to one question in my mind: is autism and autism spectrum disorder same, or it is a part of that? If you can throw some light for the yeah, common people.
So, autism spectrum disorder is now the terminology used by the American Academy of Psychiatrists, Association of Psychiatrists, in their DSM-5. So, there is a big umbrella term, and hence words like autism or PDD-NOS, that pervasive developmental disorder, not otherwise specified, Rett syndrome, or and Asperger's syndrome, all these terms have been taken away, and now it's under one umbrella called autism spectrum disorders. So,
Mm.
it's just a terminology.
Ah,
Autism is a one part of that
common.
terminology,
Yeah.
but the actual medical terminology now to be used for certification, etc., is autism spectrum disorder. But colloquially, we do use the word autism.
Yeah. Okay, fine. Since we are talking of genetics and future pregnancy, there is some talk in the medical circle about stem cell therapy. And yeah, before I forget, the link of MMR vaccine with the autism. If you can tell something.
So enough research has been done and proven that there is no link between autism and any of the vaccines. And this is what you and I have both read,
Yeah.
and even Lancet withdrew that article.
Yeah.
This is in the common realm. But I'd like to just say, if you permit my 2 cents of
Yeah.
understanding to this thing,
Yeah.
I believe this problem starts at social interaction right after birth.
Yeah.
Whereas MMR or measles is at least given after 9 months of age.
Correct. Yeah.
So
Yeah.
I don't believe in that at all.
Yeah.
And why that theory did come up, though it's obviously a wrong theory, is because of what I mentioned earlier, this so-called regressive autism. That
Hmm.
my child was normal till 1 year old because he was speaking, and then
Mhm.
he stopped speaking. What happened around 1 year old? Now, this is unfortunately how a lot of research also begins. That let's catch two things happening at the same time. Oh, they must be related somehow. That's what happens.
Yeah.
And okay, what happens around 1 year before he started regress, so-called regressing, he was given the vaccine. Oh,
Yeah.
so could there be an
Okay.
association? So I don't think so at
Hmm.
all. So that's about the vaccine. About stem cell, and this is a very controversial topic. Let me
Hmm.
put it in scientific
Hmm.
context. Is that there is no evidence
Hmm.
that by itself, stem cell therapy by itself helps autism. There is
Hmm.
zero evidence on that.
Okay.
Some of the people who are doing it, they also have stem cell therapy followed by intensive intervention therapies. Like whatever we mentioned earlier, whatever therapies are being done conventionally across the world, maybe sensory integration and a combination of all the therapies that we mentioned. There is no research paper which has shown only stem cell, only interventions, like we said,
Hmm.
and neither intervention nor stem cell.
Okay.
Whatever papers have been published for stem cell have always been stem cell along with therapy.
Combination.
So we don't know what worked,
Hmm.
but we do know that therapy by itself does work.
Hmm.
So there is no proof that stem cell by itself has any additional advantage in, at least in autism. I can't comment about the other applications of stem cell. I'm not at all aware about or an expert in those issues. But in autism, it has no evidence at all. And neither is ozone therapy or hyperbaric oxygen or
Ah.
various kinds of. So
Yeah.
we published the guidelines in Indian Pediatrics in the Journal of Indian Academy of Pediatrics in 2017 as the IAP guidelines, and very clearly we mentioned this, that
Yeah.
there is no evidence that any of these therapies are, see, because it's a chronic problem, it doesn't get over quickly. There is such a lot of social taboo. Parents are
Yeah.
devastated,
Yeah.
depressed. So everybody wants a quick fix, and unfortunately,
Yeah.
some people do try to offer a quick fix for
Yeah.
a perhaps unreasonable amount of money. So
Hmm.
maybe that's why it goes on.
Yeah, 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 very well said. Yeah. And when Dr. Samir mentioned about Indian Academy of Pediatrics, viewers, friends, this very prestigious our academy. We feel really proud of that. And Dr. Samir is National Secretary of IAP also.
Joint secretary.
Yeah, Joint Secretary, sorry. And they have wonderful digital IAP platform. In
Yes.
fact, that's the place where I heard one of his Dr. Samir's talk. It was so good. One last question, Samir. Dr. Samir, you have been in this field for almost since 2003, no? Some
Yes. Yes.
17, 18
That's right.
years, yeah.
Yes.
Uh, which is your smallest, earliest pickup of autism and the other spectrum also, which was quite delayed, picked up quite late? Youngest one and the
So,
oldest pick.
well, oldest, there have been people who've gone through life without ever having been,
Ah,
diagnosed as autism.
yeah,
Because,
true, true.
like we say, we have those children, people who are a little, not very socially active or things like that. So that can go on. But I do get a lot of children from school, from primary school, who
Mhm.
come to me with complaints of child is, very destructive in the classroom, not paying attention. And then when you go back in history,
Yeah,
well, people have suppressed. They do not see that the child is that problem. They don't recognize it at all. So
mm,
I'm not saying that they are lying, but they do not see what they do not wish to see. And if
correct.
you go back in there's a clear-cut history of impaired social interaction, social behavior, speech. Like I said, it comes to light
Yeah,
in the pre-primary. It gets covered up because the child is repeating nursery rhymes. The teachers are also happy, parents are happy, everybody's happy. But when it comes to understanding communication and behavior with a group bunch of people,
yeah.
that's when it gets obvious. The earliest I would tell you is perhaps even 8, 9 months, because there is
Oh.
something that comes up which is joint attention. So
Mm.
you may not be able to pick up 1:1 attention, but by the time the child is 10, 11 months old, if you point out to something, the
Mm.
child should be able to focus on that with you, especially a book. So when you're going through pictures by the time the child is 10, 11 months, hey, look, there's an apple. So the child should be looking at the eye, looking at the picture, looking at you, looking at the book, looking at you, looking at the book. This joint attention, along with you paying attention to a third object or
Yeah.
a third person or a third idea, that is quite easy to pick up, because this child may look at you, and then, like I said, that stare may be difficult to judge whether it
Meaning.
is meaningful or meaningless. But the joint attention definitely is something that you cannot confuse, because this
Yeah.
child just does not have that.
Yeah.
Simple things like then the child will hold your hand and drag you to an object
Mm.
instead of just directly pointing to the object straight away at that age. So all these things would be able to, and we do pick it up that way.
Yeah. Yeah. So that
And,
reminds
and
me.
just one last comment, one
Yeah.
last
Yeah.
comment.
Yeah.
It doesn't matter whether you think the child has autism or no.
Yeah.
That's the most beautiful part of my life and my work.
Yeah.
If you feel that you want your child to do better in social communication, why not? I mean, everybody wants their child to become a CEO and a, well, how is that? That's
Yes.
because you are communicating well
Yeah.
with your team. So
Yeah.
start with getting your child to communicate with you
Yeah.
and not with the mobiles. It doesn't matter whether your child has a diagnosis or a label. Everybody needs to talk to their children, enjoy, like you said, a second childhood. That was a very nice term you used. You need to do that. Don't bother about labels.
Yeah, you're right. Autism has, if you grade from 1 to 10, so many shades or level of affect.
Yes.
Children are being affected, and some of the symptoms are so early and so mild. If we look into ourselves, sometimes we also give unrelated
Yes.
answers. Sometimes we also don't
Yes.
have proper eye-to-eye contact.
Absolutely.
Yeah. So you're so right that we should embrace and accept these people, and they have slightly from 1 to 10, maybe they are on the 6 to 7 side, or maybe one or two.
Yes.
We all have in.
Yeah.
Yeah. So thank you so much, Dr. Samir. I feel like talking more and more, but you have time constraint. I'm sure, for sure, I have become so many wiser. The joint attention, the pattern, the purpose, the sound, early pickup, speech is later on, the pattern so early. You told the innate objects, correlation. Yeah, wonderful. I will watch this at least 6, 7 times. Thank you.
I wish to thank you, because
Yeah,
you have such a lovely way of doing this like a conversation. It doesn't
yeah,
feel like a
when I,
interview or anything. It
yeah,
feels
yeah,
like a conversation,
yeah.
and you're amazing at that, because you managed to make me completely at ease, and
I know.
we could discuss it very
Yeah.
nicely. So thank you so much, and I wish your show a lot of success in the future.
Thank you, Dr. Samir. And viewers, if you have more questions, I can forward. You can put it on the chat box or put in the comment box. I will forward Dr. Samir. It's okay. I can forward their questions to you.
Yes, absolutely. And also thanks to my dear friend Dr. Saurabh, because he got us in touch with each other. And
Yes.
I watched your show with when you had a discussion with him about music as well. So thanks to all of you there, and my best
Yes.
wishes to all of you
Thank you.
in the
Yeah,
Middle
yeah.
East.
Thank you so much. Dr. Saurav is doing great job here, and we feel so nice and connected to you. And yes, your DIP is fantastic. Beautiful.
Thank you so much.
And every day in morning, at least I'm spending 40, 50, 60 minutes
Yeah,
on.
Dr. Bakul Parekh, our president,
Yeah,
has been the vision
yeah.
and the vision behind it.
It's a
Thank
blessing
you
in
so much.
disguise from COVID. Thank you very
Yes.
much, Dr. Samir.
Thank you. Thank
Take
you.
care and stay safe, stay healthy.
Thank you.
And viewers, yeah, you will agree with me. I'm not, I'm not telling anything. He's one of the most handsome doctors also.
Thank you so
With
much.
that, yeah, thank you so much. Okay,
Thank you. Thank you.
bye bye,
Thank
bye
you.
bye.
Bye. Bye.